straight ahead. So the left is 85 and the right is 72. You can step out. You didn't pass that test.
No. Neck, head definitely off. My back's.
I tweaked it not too long ago, but I kind of fixed it myself with the twist and stuff. So that's probably.
Yeah, neck and lower back.
Yeah.
Okay. So we tested you as far as balance. So before you leave, you got to be within balance within 0 to 5 pounds. Now we're looking at the heels, and your right leg is a good 1/4, 5/8 an inch shorter. So that's the twist and the torque. Now do some muscle test. Hold this leg out and resist. Ready, hold. Perfect. Now, right index finger, go ahead and touch the jaw on the right side. Little teeny bit lower, right there. Now, that controls full balance. Hold this leg out again and resist. Perfect. Take the finger off. Lay onto your left side, sit up. I'm going to check the mid-back. We'll put firm pressure along the spine, tell me if it's tender or sensitive. It probably won't be painful, but it'll be different. Strongest area in the body.
No,
All the same.
nothing, yeah.
Okay, lay back onto your back, face up. Now we're going to go to the neck. We test the neck. All the nerves go into the arms and hands. Hands over your head. Showing long on the left, good 1/4 inch, so that's the shoulder height. That means the neck is off. We'll just check the head before we set the neck. And your head is not on straight, it's off to the right, which happens with people this side of the equator. If they go down to Australia, they're off to the left. Okay, yes it is. Now, we're going to ask the body through reflexes on the joints where the problem is in the neck. We're going to touch cervical number 6 on the left. Both arms again, looking for the balance. Not quite yet. Go over to 7 on the opposite side. That's the last cervical. It says no. We come up to the middle cervical, which is number 5. Goes to all the meridians and all 12 meridians in the body. It says no. We'll go all the way to the top to the atlas, balancing the head. Okay, so none of them show. So we got another issue. Lay on your left side, sit up. It's the upper thoracic cage, T1, 2, and 3. So I'm going to palpate to see if it's tender. I kind of stopped before I got here. So this is number 7, or excuse me, yeah, number 7. 1, 2, 3, 4. Any difference?
No, they're all the same.
All the same. Okay. Go back onto your back, face up. So, what we're going to do is stick the wedges, the blocks, in his sacrum to unlock that twist that we see in the heels. Roll this side up and down. Roll this side up and down. They're uneven on purpose, one high and one low. Now, show the heels. So with the blocks, the heels are now perfectly balanced. Now, if I took the blocks out, we wouldn't have corrected anything because we haven't corrected the steering wheel up here. So now we're going to go ask this neck again if it'll show up with the blocks. Number 6 again, same vertebrae. And there it is. It says, okay, I'll show you, I'm here. Now you're going to assist me. Turn your head to the right. We're going to make a physical hand adjustment to cervical number 6. Notice how we've turned your head. You don't want to have the doctor twist it when you adjust it, so it's already turned. Chin up just slightly. I come under the chin with my right arm. We'll do a little traction. Make sure there's no discomfort in the spine, no pressure on the chin. Come down on C6, and it's all about the speed. Breathe in. Let it all out. There it is. It is tight. Now turn your head right, left again. Chin down and chin up. And ear to shoulder, ear to shoulder. This is to move all the joints to see if they're now balanced, both arms. There it is. Perfect. Now, the head itself is still off. So we'll do an instrument adjustment first. If it does not work, then we'll do it by hand. Now turn your head to the left. This is a double-headed activator instrument, and it makes a little click sound. I put my fingers on the base of the skull, so it's very gentle, and we do 3 clicks with respiration. Breathe in and out. Okay, now to test it against gravity, your body doesn't know what I did until you stand up and hit the floor. It says, oh, that's where the head was before. Face up again. Check the whole system again from heels to head. Heels are now perfect. Now, hands over your head, checking the neck again. The arms should come up symmetrical, and they do. Now the head itself, did it set? It did not. So we're going to do it by hand. Roll onto your stomach, face down. Now, I'm going to show you how the system, we can also see that the heels now, once we flip them over, show that they're not balanced. Now, let's see which way we're going to put this. Roll this one up, down. This one up and down. Nope. Let's switch them. This one high, this one low. So the tailbone, the sacrum, is where the two sacroiliac joints that carry all the weight attach. Okay, he is stuck. So. Now, raise your head up. I'm going to take my forearm, slide it underneath the chin. So it's just resting on my forearm. And we come behind the ear onto the occipital bone. We'll do a little stretch, open the joint up, set it, and it'll probably make a little click sound. Breathe in. So this is an occipital adjustment to the head itself on top of the atlas. There it is. Now, another test drive, please. Stand up, walk around. That's why you're able to go to sleep. So after I correct it, I have to stand you up. You go, oh, that isn't where I was before, and the whole system shifts, and I can recheck it again after the walk. That's to make sure it's balanced. Still slightly long on the left. Now we'll come back, arms above the head, check the neck again. And there it is. So we've got more to do in the neck. See, that's one of your main complaints today. Number 7, both arms. There it is. Now, we're going to set number 7. You're going to assist me again. Bend both knees up, feet couple on the table. Turn your head to the left. Down to C7. The last cervical vertebrae attaches to the thoracic where the ribs attach. Breathe in, let it all out. Again, a little traction, and we set it. There it is. Now, both arms again. Now it's balanced. Now, one more test drive to make sure it's perfect. And then we put you on the scales to make sure you are perfect. And then you can tell everybody the Dr. S says I'm perfect. Don't let it go to your head. Okay, both arms again, please. Okay, looks good. Back down to the heels for the hips and lower back. Not quite. Oh, sorry. It's okay. It's hard to lay down perfectly on the table. Now, back on the scales. And this is a diaphragm test. The diaphragm sits right here at the base of the rib cage. When the abdominal muscles traction, the diaphragm is pulled down and the stomach will gradually rise. So I'll put one hand on the stomach and one hand on the chest. Take a big deep breath. And there it is. So that is working.
Look at 75 on the right and 80, 79, 80, it's still thinking 80 on the left. 75, 80, 75, 82 goes back and forth. You can step out.
Start whenever.
Uh-huh.
All right.
Now we find that the spine shrinks up to 2.5 inches over life, and so what happens is the discs in between the bones shrink. So we want to keep the discs hydrated so they keep their space. And that's how we keep it in the neck. Now, show us the twist stretches. So you twist your shoulders and you look over the shoulder with your neck, so you're rotating your neck and your shoulders as far as you can comfortably right and left. We teach patients to do 100 a day of the bobbleheads and the twist stretches to keep their spines hydrated so they don't shrink.
Thank you.